Finally, let's talk about the dosage form factors. These include disintegration and dissolution time, manufacturing variables, pharmaceutical ingredients, nature and type of dosage form, product age, and storage conditions. Disintegration time clearly affects the rate of absorption of the drug. Lesser is the disintegration time, faster is the absorption. This disintegration time, if we talk about a tablet, it is directly proportional to the amount of we have added in the tablet formulation. More is the binder, more is the disintegration time. In case we need to decrease the disintegration time, we either reduce the amount of binder or we add a disintegrant in suitable amounts in the formulation, because disintegration is not enough. After the disintegration of the tablet, it has to form granules, and the granules must further deaggregate to form fine particles, because dissolution from these fine particles is much faster than that of the granules. Next factor is the manufacturing variables. Now, what are the variables which can be performed or which are advocated during the manufacturing process of the dosage form, which will affect the absorption of a drug? What is the method of granulation we are adopting? Whether it is dry granulation or wet granulation, and what is the compression force that we are applying? If we are using wet granulation method, it would give us a faster rate of dissolution compared by other granulation methods. But then there are limitations of wet granulation. These include crystal bridge formation or chemical degradation. To solve this problem, a superior method called agglomerative phase of comminution has been developed. This involves grinding of the drug until spontaneous agglomeration and granules are prepared with higher surface area, which will impart higher dissolution rate. Then comes the compression force under manufacturing variables. The amount of force we apply on the tablet while punching it not just influences its disintegration time, but also influences the porosity, density, hardness, and dissolution of tablets. If you see in the graph A, compression force versus rate of dissolution is plotted, we see higher the compression force, lower is the rate of dissolution. Now, how does this happen? As the compression force increases, the density of the tablet increases. The density of the tablet increases, the hardness also increases. As the hardness increases, the porosity of the tablet decreases. If the porosity of the tablet is decreasing, the solvent penetration into the tablet will tend to decrease. Because of this, a sealing sort of layer of the lubricant is formed. Now, this layer forms a tight bond between the particles. As a result, this decreases the rate of dissolution. Then, you see another condition in curve B. Here what is happening is, as the compression force is increasing, deformation such as fracture of drug particles takes place. This leads to formation of smaller particles, or basically particles with larger surface area are formed. Larger surface area imparts increase in the rate of dissolution. Now curve C and D, if you observe carefully, are combination of curve A and B. So we anyhow need to understand what is the dissolution, what is the rate of dissolution by carrying out the studies. These curves, they just show how the compression force influences the rate of dissolution. Another dosage form related factor which affects the drug absorption is the nature and type of dosage form. It has a direct impact on the drug absorption and hence bioavailability of a drug. In the diagram, you can see how every dosage form undergoes a few steps, some of which are the rate limiting steps of every formulation, before the drug is absorbed. Conventional dosage forms may be broadly categorized in the order of decreasing dissolution rate as solutions, suspensions, capsules and tablets, coated capsules and tablets, and controlled release formulations. When a drug is in the form of a solution, of a monophasic solution, such as syrup or elixir, it is most rapidly absorbed. Why? Because here drug dissolution step, which is the rate limiting step, is absent. The drug is already in the dissolved state in the vehicle. Then comes the emulsions. Emulsions come next to the solutions but are still better than suspensions for administering poorly aqueous soluble drugs. What happens is emulsions have a large surface area. How? Because of the presence of oil droplets. So the large surface area due to oil droplets to the GIT assists in absorption of the drug. Example can be taken of indoxazole. It is an acid which, when dissolved in vegetable oil and emulsified in water, shows an increase in absorption up to 3 times as compared to its aqueous solution. Next in the line are suspensions. Drug dissolution is the rate limiting step in the absorption of drug from the suspension. It is quite fast due to the large surface area of the particles present in it. So, we can say that the factors of the suspension which affect the bioavailability of the drug are the size of the particles, polymorphism, the wetting agents, the viscosity of the medium, and the presence and type of suspending agents. Then comes the powders. The factors which affect the bioavailability of a drug from powders include particle size, polymorphism, and wettability. Then comes the capsules. Capsules still have better absorption as compared to the tablets. So basically, granules or the powders or the slugs which are incorporated in the capsules, these can be administered in the form of hard gelatin capsules or soft gelatin capsules. There are different factors in both kind of capsules which affect the drug bioavailability. Like in hard gelatin capsules, particle size, polymorphism, density, packaging, packaging of the granules or powders inside it. These affect the bioavailability. Hydrophilic diluents like lactose, these increase the wettability. As the wettability will increase, the deaggregation of poorly aqueous soluble drug. To the contrary, soft gelatin capsules dissolve faster than hard gelatin capsules and tablets. These show even better bioavailability from oily solutions and emulsions. If we again take the example of indoxazole, it has a higher dissolution rate in the form of soft gelatin capsule as compared to hard gelatin capsule and even aqueous solution. Poorly soluble drugs can be dissolved in PEG with the help of surfactants and get encapsulated without difficulty. In case of coated tablets, the sugar coated tablets take longer time to dissolve. Then is the enteric coated tablets. Enteric coated tablets may address the problem of increasing the bioavailability by getting dissolved only in the alkaline pH. That is, when the drug enters the intestine. So, overall, pharmacological response may eventually be delayed to up to 6 to 8 hours till the drug reaches the intestine and gets absorbed from there. Then is the sustained release products. In case of sustained release products, sometimes there could be cases of dose dumping, and this makes the drug release unpredictable. So, as a general rule, the bioavailability of a drug from various dosage forms decrease in the order of solutions, then emulsions, suspensions, capsules. In capsules, first soft gelatin capsules, then hard gelatin capsules, tablets, coated tablets, enteric coated tablets, and sustained release products. Various pharmaceutical ingredients other than the API which are used in a formulation may include vehicles, diluents, binders and granulating agents, disintegrants, lubricants, viscosity enhancing agents, and surfactants. If we speak about the vehicles, the rate of absorption is directly related to the miscibility with a biological fluid. More is the miscibility or aqueous solubility, faster is the absorption, more is the bioavailability. Hydrophilic diluents, which, when coated around the hydrophobic drug particles, promote drug dissolution, thus increasing the absorption of poorly soluble hydrophobic drug. If we talk about the binders, as the binder increases, tablet hardness increases, which decreases the rate of dissolution and disintegration. Increasing the amount of disintegrants decreases the bioavailability. Most of the disintegrants are hydrophilic in nature. The lubricants are added to the formulation to enhance the flow of granules. This reduces the friction between the particles and addition of these particles to the dies and punches of tablet press. Most commonly used lubricants are hydrophobic in nature, such as magnesium stearate. These inhibit the wettability, penetration of water into tablets, and their disintegration and dissolution. This is because the disintegrant gets coated with the lubricant if blended simultaneously. To avoid this, it is advised that the lubricant is added in the final stage. Suspending agents like sodium CMC, suspending agents like CMC stabilize the drug particles by reducing their rate of settling. These also sometimes increase the viscosity. Increase in viscosity acts as a mechanical barrier to the diffusion of drug from the dosage form into the bulk of GI fluids, and from GI fluids, mucosal lining by forming a layer around the GI mucosa. They also retard the GI transit of drugs. Now, surfactants are widely used in pharmaceutical formulations for various purposes, such as wetting agents, solubilizers, emulsifiers, etc. Now, they may enhance or retard the drug absorption. The cases in which surfactants increase the absorption of the drugs in the cases where they enhance the wetting properties and dissolution of drugs. Example, tween 80. Or they increase the membrane permeability of the drug. Whereas they decrease the drug absorption where they form unabsorbable drug micelle complex at surfactant concentration above CMC or critical micelle concentration. Even though the colorants are used at a very low concentration, they influence the rate of dissolution. A low concentration of water-soluble dye can have inhibitory effect on the dissolution rate of several crystalline drugs. The dye molecules get absorbed on the crystal surfaces and inhibit the drug dissolution. For example, brilliant blue retards the dissolution of sulfathiazole. In case of solutions as dosage form, precipitation of drug due to altered solubility or conversion of metastable into poorly soluble stable polymorph can occur during the shelf life of the product. In case of suspensions, change in particle size distribution results in decrease in the rate of drug dissolution and absorption. If we talk about the storage of tablets, the disintegration and rate of dissolution are greatly affected due to aging and storage conditions. Increase in these parameters of tablets has been attributed to the excipients which harden on storage. For example, the binding agents like PVP, while decrease is mainly due to softening of the binder during the storage. This is the storage condition and age of the product affects the drug absorption.